I think it's human nature to be scared of the future and scared of change that comes with the future. And we talk about here at Grapevine this concept of 11:59 p.m. It's the moment where today, the present, meets tomorrow, the future. And that's where you need to bring your customers to be a comfortable and silly minute away from the future, right? You need to meet them where they're at, and you need to preserve what's important to them while upgrading the things that frustrate them.
You're selling into a very tough industry. It's an industry it's complex, right? There's so many players and it's hard to drive change. So what are you seeing in terms of the willingness of your customers to do something a little different? And who are your customers? Is this administration? Is it medical practitioners? Who's driving the change?
Yeah, there's two different ways that we've seen Grapevine adopted and roll out within a healthcare practice or a healthcare system, right? There's the top down, which has more to do with, communicating and talking with leadership, specifically financial leadership, about opportunities to save huge amounts of money. And, then propagating that opportunity down to the level of the clinicians, the nurses, the office managers, right, that actually know when something's out of stock or use the supplies, with the patient. And then engaging with the clinicians or the office managers to handle sort of the reordering and optimization of supplies and subbing in and subbing out products and so on. That's sort of the more top-down adoption that we've seen with larger institutions where the decisions are made by those higher level people. But we also have seen it, right, in success in working directly with the clinicians themselves, right? And the pitch is very different in that setting. It's not about saving money. It's about saving them time, about letting them order on their feet when they open the supply cabinet. Did you know that of all those big multi-$100 billion, revenue industry giants that dominate the space, not one of them has an app that you can order supplies from your phone? You got to go back to your desktop computer. You got to think about
Unreal.
I'm in the patient. I open the cabinet. There's no needle to draw blood. What do you do?
Yeah.
Well, pause. Remember that, right? Write it down or something, and then bring it back to your desk, because 3 hours later, that's when you're going to order your supplies. So it's the little things that actually matter to the clinicians to make their lives easier in managing supplies and letting them focus on the patient that have been a huge success point. And from there, Grapevine can propagate through to the top, to the decision makers, and we can start implementing different practices to save money. So we see it flow sort of two different ways, but both have led to great success.
That's awesome. There's another founder that came on the podcast a few episodes back, a woman named Cheney, and she's in the health space out of Canada. She said something really interesting. She said, nothing kind of weighs us down more than kind of the weight of the status quo when we know it doesn't have to be that way, right? And I think that example you just gave is so fascinating, right? We know that technology today is capable of allowing just-in-time ordering, note-taking, making it so we don't have to, remember to refill the cabinet. And the dissatisfaction that you can sell into seems to come from the gap between what they have to do today and just knowing that it's possible. Do you find those little points of dissatisfaction are really useful triggers to have a deeper conversation?
Absolutely. I think that I think it's human nature to be scared of the future and scared of change that comes with the future. And we talk about here at Grapevine this concept of 11:59 p.m. It's the moment where today, the present, meets tomorrow, the future. And that's where you need to bring your customers to be a comfortable and silly minute away from the future, right? You need to meet them where they're at, and you need to preserve what's important to them while upgrading the things that frustrate them. And that's what a lot of the first 6 months, dealing with those punches and recalibrating, that's what it was all about, right? Like understanding not just how on paper, or in reality, you can save a business a lot of money and how that's a good thing, but the tiny details that make the step into tomorrow very smooth and very effortless. and it comes from the small things, the things that aren't easy for the customer to explain to you, the things that are, implied. And you understand that when you really study and obsess over the customer and their experience and their struggles and their priorities.
Well, what are you tracking these days that inspires you? Like you're, 11:59, moving into the next day. What's in the headlines? What's happening in tech or around us that gets you to just kind of lean in and be like, oh, this is cool. This is why I'm optimistic and why I'm doing it. Have you seen anything recently?
Well, I'm definitely an optimist. And I think it takes a bit of an optimist to, take the risks and do the types of things that we're doing. I'm fascinated by almost anything if I stare at it and study it long enough. So there are a lot of things that have captured my attention in my world. The details and the beauty of logistics and moving supplies from point A to point B more efficiently, standardizing information from different sources, but they're not the sexy like headliner events. Like honestly, yeah, when it comes to things like machine learning and AI, we use it. There are basic models that are folded into the way that shoppers shop, the way that we calculate misuse or clinical behavior in overuse of certain supplies. But those things are tools at the disposal of entrepreneurs to be applied to new problems. The things that really excite me are better understanding like where today is, and then marrying it to the most cutting edge tools that are out there. And yeah, that's where we've made magic happen.
Well, and I hear you. Although I think a predictive model that can actually help someone make an informed decision about what they're going to need in the future, I think that's pretty sexy. Like this is stuff that we've been talking about for years, decades, but is actually becoming much more of a reality, right? There are tools available to you off the shelf that help you build something that possibly prevents the nurse from ever actually having to think about ordering in the future.
Yeah.
Right. And I mean, like all of a sudden we're living in a world where we're kind of like, wait, of course that's possible. Of course that's possible. And now it's hard, right? It turns out it's actually a little bit harder to get these predictive algorithms to take into account every variable than we think. But of course it's possible.
No, and it's really cool. We look at things like upcoming scheduled patient visits, right? Like, which by the way, they vary a ton throughout the season, right? Like a certain type of doctor might see 10 times as many patients in December, if they're treating flu or different types of things. So we actually read in upcoming scheduled patient visits that feeds our algorithms to predict how much supply you're going to need. And then we adjust orders that are automatically placed without you going on your computer, going on your phone, right? We know the supplies that you need. We know the types of patients that you're seeing coming up, what's going to be used in those clinical settings, and the orders, the entire supply chain can really be put on autopilot. And I do think it's sexy, by the way, Ian. Yeah. But I've been told by some of our VC partners who have given us money, which is crazy. They're like, yeah, we love these very unsexy, boring, types of problems. That's
I
our
love
niche.
investing in boring.
Yeah, I'm like, all right, I guess that's what we are, man.
No, you know what? There's a difference between boring and one of those problems that nobody is actually spending enough time thinking about, and therefore it's just not in the the common lingo. I don't know. I was talking to a health system, a big international health system, not in the U.S., not that long ago. They were telling me that they have, depending on the time of year and the area of practice, between 30 and 60% no-show rates, and it's unpredictable. Mm-hmm. And, okay, so that's a problem for lots of reasons. But one of those reasons is consumables and its placement of the consumables and its expiration, and it's the enormous amount of costs associated with them. So there's stuff just in this conversation that's clicking for me and connecting patient communications with externalities like everything from weather to holidays that get in the way to supply chain. And you're like, oh man, there's a lot of data out there to work with. And where there's data, there's room for optimization. And where there's room for optimization, there's room for innovation. So super cool.
Absolutely.